Heart disease is the leading cause of death among all Americans. USC Verdugo Hills Hospital is uniquely qualified with our outpatient cardiovascular rehab that meet the needs of patients dealing with these type of issues in our community.
Cardiac disease is a chronic disease, so once you have your event, you're not done with it. You're at risk in the future. So you can lower your cardiac risk by, beyond drugs, by participating in a cardiac rehab program.
Cardiac rehab requires a referral from a physician. It's usually for patients that have suffered an acute cardiac event, whether they had a heart attack, a myocardial infarct, congestive heart failure. If they had a stent placement or any kind of cardiac surgery would be covered for that. Medicare and other insurers allow for 36 paid sessions for them, so they are monitored with an EKG throughout their exercise session. The exercise is prescribed and it's also progressed by the exercise physiologists that are monitoring their care.
An exercise physiologist develops and designs exercise and fitness programs for those that have clinical conditions like cardiovascular disease, pulmonary disease, and diabetes. Supervised and monitored exercise programs involve taking some kind of measurement of the subject's heart's performance during an exercise session so that we can monitor for things like arrhythmias or other complications that may be dangerous. It is important to have a monitored program for someone that's had a cardiac event because the likelihood of adverse events is much higher in these individuals. So it's imperative that they're exercising in a medically supervised setting.
I said, oh no, here comes a big one. As it all turned out, a couple of stents got me back up to speed, and in that process, that's where a nurse encouraged me to get involved in a cardio rehab program. Initially, when I started, the first 3 months I was monitored, which really was quite impressive to me what they were doing in terms of telling me about what my body was doing and how it was responding to this rehab. But that was only the first 3 months. Since then, I've stepped over to Rick on different occasions and asked him to take my blood pressure or ask him technical questions about the equipment and things I should or shouldn't be doing.
So our continuous aerobic maintenance program, also known as CAMP, is a program where our patients that have graduated from the cardiac rehab services can still exercise with the supervision of our exercise physiologist. They no longer require monitoring from the EKG monitor, but they still can exercise in an environment where they're supervised. What makes our program different from most places is that here at USC Verdugo Hills Hospital, we address the whole person. So besides addressing their physical needs in the cardiac rehab program, we also offer wellness classes for these individuals as well.
We offer a very nice, nurturing environment. Staff is non-intimidating and they're very caring, and beyond providing an excellent structured program, it's a nice social network of people who care about each other. We are now thinking that the lack of exercise is a risk factor for coronary disease. Cardiologists now are hoping to get patients to exercise for primary prevention.